Hello again. This presentation is about how the autonomic nervous system affects cardiac output, specifically the amount of blood pumped, the heart rate, and the strength of heart contraction. I'm going to talk about what factors affect cardiac output and how they work to accomplish these changes. And this is for Human Physiology 2 with Dr. Waller at Grand Canyon University. And I always like to provide some background information, and today I'm going to do that as well. So I will start by outlining just a basic circuitry of the heart and how it's normally controlled. And I will go through the two branches of the autonomic nervous system independently. First with the sympathetic nervous system and how it affects cardiac output, and then I will discuss the same with the parasympathetic nervous system. And finally, I will address some health problems that can arise when these two systems are not functioning properly, and some ways we can work to maintain cardiac health by supporting our autonomic nervous system, as well as some of the research that's being done in that field. All right, so if you look on this image on the right, you can see how the heart's own cardiac conduction system works. The driving force of heart activity is, of course, the sinoatrial node in which pacemaker potential begins. This action potential then moves through the atrioventricular node, through the bundles of His, I'm drawing it, and then down through those Purkinje fibers in the heart's ventricles. Cardiac contractile cells are activated in unison from this action potential due to their unique structural branching, if you remember the desmosomes and the gap junctions. And unlike skeletal muscle fibers, cardiac muscle lacks this twitch summation characteristics so that they cannot be contracted for an extended period of time, but instead they must undergo a prolonged relaxation period called a refractory period before contracting again. These characteristics are what allow the heart to act as a dual pump, enabling blood to fill the chambers and then be expelled in a rhythmic manner. Although the heart has its own circuitry, research, along with our own common sense, right? Our heart beats faster when we're exercising or nervous, tells us that our heart rate and our blood pressure, the strength of contraction can all vary under the influence of stress, exercise, sleep, or even nutrient consumption. So what affects these changes? In this next slide, I will review the autonomic nervous system before going into the specific biochemical mechanisms that change the heart rate, contraction strength, and cardiac output of the heart. If you are familiar at all with the autonomic nervous system, you may already know that this branch of the peripheral nervous system is further divided into the sympathetic and parasympathetic branches. These two branches generally have opposite effects on their target cell tissues, and they have different primary neurotransmitters, with acetylcholine being the neurotransmitter of the sympathetic nervous system and norepinephrine being the primary neurotransmitter of the parasympathetic nervous system. You can see here in this image that the autonomic nervous system innervates all systems in the body, and parasympathetic heart innervation primarily originates at the vagus nerve or cranial nerve 10, whereas sympathetic innervation originates from spinal nerves T1 through 5. Okay, now I'm just going to go over a few different definitions here. Cardiac output refers to the volume of blood pumped by each ventricle each minute, and is the product of other variables such as the amount of blood filling the heart during diastole, which is known as the preload volume, the stroke volume, or the amount of blood pumped out by each ventricle with each heartbeat. These mechanics are directed by an increase or a decrease in heart muscle contractility due to extrinsic control from the autonomic nervous system. And I would like to note that the volume of blood flowing through systemic circulation is the same as the volume flowing through the pulmonary system, and cardiac output from each ventricle is typically the same. Overall cardiac output depends on two things, heart rate and stroke volume. So let's talk about how the autonomic nervous system brings about these controls. And I put a whole lot of words on this one, so I'm going to start with the top little picture on the right here. You can see the solid black line is the normal depolarization and action potential of those cardiac pacemaker cells, and the red dotted line shows the action potential rate increase under the influence of the sympathetic nervous system, which is epinephrine. The first thing that happens is that the IF, or funny channels, and T-type calcium channels are changed or augmented so that there is more of an inward movement of sodium and calcium, effectively speeding up depolarization. Secondly, there is a decreased atrioventricular nodal delay. Remember that the AV node is a secondary pacemaker in the heart circuitry, and this is due to an increase in the velocity of inward bound Ca2+. Now in this bottom image, you can see the depolarization of the actual contractile tissue in the heart, as well as the actual muscle contraction that corresponds. Another thing that happens under the influence of sympathetic input is that the L-type Ca2+ channels are opened for a longer period of time. And what this does is that it increases the strength of the muscle contraction by increasing calcium permeability. If you remember muscle physiology at all, you may remember the special pump called the sarcoendoplasmic reticulum Ca2+ ATPase pump. This is something that is unique to skeletal and cardiac muscle cells, and under the influence of sympathetic or that fight or flight input, that SERCA pump is enhanced, which allows more calcium to be available to open up those myosin binding sites at the troponin and tropomyosin complex so that stronger contractions can occur. What this means in terms of cardiac output is that increased heart rate means blood is being pumped through the cardiac system more rapidly, and since the contractile strength is increased, each contraction produces a higher stroke volume than at resting. So just to put that into context, a resting heart has a typical stroke volume of about 70 milliliters per beat, and the average human pumps about 5 to 6 liters of blood per minute. But a heart under extreme sympathetic stimulation can pump up to 35 liters of blood per minute. This makes sense, right? Because a running or jumping body needs a lot more oxygen from blood than a body at rest. Okie dokie, now to our glorious parasympathetic nervous system, which is known as the rest and digest system, and calms us down and also works to slow down the speed and strength of our heart rate. You can see in this bottom image shows a much slower depolarization to threshold about 8 milliseconds, and leading up to peak action potential, and then during repolarization, the normal resting heart rate repolarizes to about negative 60 millivolts, whereas under parasympathetic stimulation, the membrane potential becomes hyperpolarized down to about negative 70 millivolts. This is accomplished due to an enhanced potassium permeability at the end of an action potential. And this occurs due to increased potassium permeability of pacemaker cells in the sinoatrial node by binding with cholinergic G protein coupled receptor channels. Recall also that the sinoatrial node is a driving pacemaker in the heart, so that increased polarization slows the rate of spontaneous depolarization by becoming hyperpolarized after each action potential, making it more difficult to reach threshold once again. Acetylcholine also inhibits the cyclic AMP pathway, which slows the movement of sodium and calcium through T-type channels and funny channels. And finally, the plateau phase of contractile tissue is shortened, which I apologize I could not find a suitable image that would fit here, but that plateau phase in contractile tissue is shortened due to a reduced inward calcium current, which weakens the cardiac muscle contraction. Generally speaking, our heart is always under some level of parasympathetic control because the normal activation of action potential in the sinoatrial node would give us a resting heart rate of about 100 beats per minute. When we are asleep or extremely relaxed, we might see this influence decrease heart rate and strength of contraction even more, down to about 40 to 50 beats per minute. And studies have shown that cardiac output decreases by about 25% during sleep as well. And just anecdotally, we all probably know somebody who has had a heart attack following a stressful event, or who experiences dangerously high blood pressure with a panic attack. These are examples of how dysautonomia, which is kind of an imbalanced autonomic nervous system, coupled with other cardiac risks, can be dangerous or even deadly. Autonomic dysregulation has been implicated in arrhythmia, as well as a number of cardiac diseases such as myocardial infarction, heart failure, and even sudden cardiac death. So the current treatment for many of these issues is pharmaceutical and includes the use of beta blockers, for example. However, there is research into more physical interventions such as cardiac sympathetic denervation or stellate ganglion blockade, which physically alter the extent to which those sympathetic ganglion nerve fibers impact the heart's pacemaker cells. However, there are preventive measures which have been clinically shown to improve autonomic tone. And this is a quote from one of these studies. Although non-physiologic stresses increase the risk of adverse cardiovascular events, normal physiologic sympathetic activation, such as during exercise, improves physical conditioning, mood, and cardiovascular prognosis. Excuse me. Exercise transiently stimulates the sympathetic nervous system, but because it strongly augments background vagal activity, it is an effective and practical means to restore a healthy balance of autonomic tone. So what that means is that intentional physical stress, such as cardiovascular or weight-bearing exercise, stimulates the sympathetic nervous system, of course, but also works on the parasympathetic nervous system. So it was also shown that in a recent study that regular walking decreases sympathetic nerve activity as well as blood pressure in men who have high blood pressure, and also frequent physical activity reduces sympathetic activity through secondary factors such as weight loss, greater insulin sensitivity, decreased anxiety, and depression. As a general rule, we can practice mindfulness and eliminate other sympathetic stimulators like excess caffeine, alcohol, or nicotine. And this is where I found my pictures. And here are my sources. Thank you so much.